Activated, your window into how we can change the way in which we aspire for persons with disabilities, how we change our expectations from seeing inability to expecting ability. Activated takes us on a journey of taking lessons from persons with disabilities in how we must do things differently to unleash the contributions persons with disabilities can and must make to building a disability-inclusive Mzansi. Hello and welcome to Activated with me, your host, Taryn Tomlinson. Economic and social participation of persons with disabilities depend to a large extent on the awareness and knowledge university graduates have of universal design and disability inclusion measures required to create access in their respective professions. It's therefore important that persons with disabilities own the academic space if we are to transform university curricula and change economic outcomes for persons with disabilities. In today's episode, we look at shaping the economic and social transformation agenda through disability-inclusive research. Now, let's get activated. This week, we visit Zukiswa Zuki, who holds a BCom Honours in Economics and who joined the disabled community shortly after qualifying as an economist following a motor vehicle accident. We visit Brandon Beack, co-founder of Walking with Brandon Foundation, an NPO founded in 2015. Our guest for today is Dr. McKinney, who has played a significant role in transforming the UCT campus and curriculum offerings to be less disability blind and more inclusive. Die Sentrum vir Menseregte aan die Universiteit van Pretoria Fakulteitregte Suid-Afrika is 'n organisasie wat hom toespits op die bevordering van menseregte op die vasteland van Afrika. The Disability Rights Unit at the Centre for Human Rights is committed to finding evidence-based ways of addressing the rights of persons with disabilities on the African continent.
In 2020, when the World Health Organization declared the COVID-19 pandemic a global pandemic, we, as in the Centre for Human Rights, along with 6 other disability rights organizations from across the globe, decided to assess the impact of the global pandemic on persons with disabilities. So the survey was distributed across the globe in about 134 different states from different continents. And then persons with disabilities were also able to have a say in terms of what recommendations they thought governments should implement in order to ensure that the response to the COVID-19 pandemic is disability inclusive. One of the findings was that after lockdown measures were in place in many countries, persons with disabilities were cut off from their personal assistance, so they were not able to access their personal assistance. And this had a ripple effect in the sense that then it meant that they could no longer have access to health care, which is all sort of related to the lack of community services for persons with disabilities. The survey also indicated that there was a lack of information. The COVID-19 pandemic was new to all of us in the world, and so information was very important and remains important during the subsistence of the COVID-19 pandemic.
As governments rush to respond to the virus, it's more critical than ever to guarantee that measures taken are fully inclusive of persons with disabilities. After the break, Zukiswa, who holds a BCom Honours in Economics, joined the disabled community shortly after qualifying as an economist following a motor vehicle accident. Zuki shares with us her findings on how to advance our dismal employment equity statistics in South Africa. Don't go anywhere. When Dr. Vic McKinney became disabled, he was told to go live in a home. His mother refused, and he has fought to be included in society since. Vic believes that South Africa's biggest challenge for disabled people is a lack of inclusion. When he talks to people, he tries to make them understand that being in a wheelchair does not change who you are and your need to be part of society. So, welcome, Dr. Beack. It's so lovely to have you here with us today.
Pleasure, thanks. Thanks for inviting me.
And we also want to say congratulations with your PhD that you obtained in 2016. Vic, leading from your experience, what do you believe is the biggest challenge faced by persons with disabilities in South Africa?
So I've always looked at it, there's a kind of a dual challenge to disability. The one is just looking after your needs. So for example, I need to get washed and dressed in the morning. Somebody has to do that for me to maintain my basic health. And the second one from that is, how do I get involved? How do I participate? How do I become a member of society? So I think it's a duality to that question. So I think it's immediate needs and having an accessible environment where someone with a disability can get on a train and go to town to get to work or to school and have that available.
So inclusion is a very big part of that. And what lessons can you share with us as a researcher in terms of influencing disability inclusion in universities?
We need to deal with things on all levels, I would say, and at the same time, collaborate a lot more. And I think collaboration is key, as well as addressing things on all levels. So by that I mean, we need to make places accessible. So with an address, and I guess it's far easier to tackle a new building being built, developed in the city of Cape Town, for example. It can be more challenging trying to redress the design of a township. It's about getting people with disabilities being able to participate. And I think the more that happens, the less stigma there will be around disability. Because as people participate and as they're involved and included in society in general, then myths and preconceptions disappear. The more you interact with somebody, the more you get to know them. The key thing behind everything is to involve people with disabilities and involve the member organizations and make it also a cross-sectoral approach. You can't just have one department dealing with disability. That's impossible. It's got to be across all departments. And there's got to be like a directive across all areas, whether it's transport, healthcare, social grants, etc.
Before we end, are there any last comments you'd love to leave our viewers?
I think we're just staying with focusing. I think we have a real opportunity, and actually something we must do, is to incorporate the topic of disability in higher education. In South Africa, we are constantly producing graduates, and fantastic graduates, from lawyers to engineers to doctors and healthcare workers to architects and businessmen and women and our future entrepreneurs. And they know nothing or very little about disability and how to accommodate persons with disabilities in this country. We currently have about over 1.1 million recipients of disability grants, which equates to about 22 billion. And those are adults between 18 and 59. And they represent the workforce. If we get at least 10% of people of those working, and this is a real possibility, we are automatically saving the country 2 billion. So from an economic point of view, it makes sense. And we need research-driven projects across. We need to teach our future professionals about disability, how to get them involved, how to make people taxpayers, and it can be done. And that'll be a huge way, not only including people with disabilities and empowering their lives, but make an inclusive society overall.
Thank you so much, Vic. It's been an absolute pleasure talking with you. We wish you a wonderful day further.
Thank you. Thanks very much.
It's taken Dr. Vic 2 years longer than expected to complete his PhD because back then, there weren't any assistive devices to help him use his PC. Now he can much more freely express his ideas that he has. Nadat Zukiswa Zuki en Zo haar BCom honeursgraad in ekonomie aan die voormalige Potchefstroomse Universiteit voltooi het en haar weg in die koöperatiewe wêreld gevind het, was sy beseer in 'n motorkappen wat haar verlam gelaat het. 8 maande na die voorval moes sy die wêreld tegemoet gaan as 'n persoon met 'n gestremdheid. Sy was gekonfronteer met die hindernisse wat die volle deelname van persone met gestremdhede in die samelewing beperk. Dit het haar laat besef hoe noodsaaklik dit is om mense se houdings te verander en sluit toe aan by die gestremdheidssektor. Out of over 40,000 applicants, Zuki was one of the young Africans chosen to be part of President Barack Obama's flagship program, the Mandela Washington Fellowship for Young African Leaders, where she pursued a 7-week program in leadership.
My name is Zukiswa. I'm commonly known as Zuki. My surname is Nzo. I was born in Potchefstroom, which is where we are right now. And I went to Potch University to study a BCom in economics. And shortly after graduating, I landed a job in Johannesburg. I had just been offered a permanent employment. And just after signing my contract, went home to celebrate this new job that I had gotten. And as we pulled into a residential complex with 2 friends in the car, a guy came to my window and he says, "Ngicela my phone," and he's pointing a gun at us. While I was trying to reach in my bag for a phone, he probably thought I was reaching out to get a weapon or something. And that's when he shot me. I then spent about 8 months in hospital, 4 months in ICU and 4 months in rehab, where I learned that I wouldn't be able to walk again. I took my situation as uNkulunkulu wanting me to use it for the good. I took it as a positive situation that will allow me to contribute towards the things that really make me tick, which is seeing fairness and equality and inclusion and seeing that people are treated in a just manner. After studying my BCom in economics, I decided to join the disability sector, and I realized that I don't have enough knowledge on disability. So coming from that background, it made me want to get formal training on disability, which is what I did, so that I don't speak from a personal place, but I speak from a scientifically tested and verified informed position when I represent disability.
And our next Ignite speaker is representing Indiana University, Zukiswa.
Self-representation is very key, meaning umuntu okhubazekileyo is probably in a better position to understand about impairments. By virtue of having an impairment, it doesn't necessarily make me an expert on disability. Competence matters. Otherwise, if I don't have the skills and the knowledge, I might do an injustice, and I cannot just teach and publish papers just by virtue of having an impairment. I advocate for more disabled people to actually take on disability studies so that they can advocate from an informed position. But at the same time, because of the biases that exist from both disabled researchers and non-disabled researchers, I do believe that we need to work together, to provide a more balanced output. And that also becomes an example of true inclusion, and we eliminate the us and them that is already existing. There's a bit of a disconnect, and it goes as far as just reaching a consensus on how we define disability between government as policymakers and academia as knowledge creators, as well as civil society as advocates. I wish that there could be more dialogues between the three parties. That practice is what will then inform policy, and then policy will then dictate to the implementers what needs to be implemented. I was fortunate enough to be selected as one of the first disabled people in South Africa to become a Mandela Washington Fellow, which was President Obama's flagship program for young African leaders, and the first disabled African to do a master's in Japan. I received a Social Transformation Award for Gauteng. And as I said, I cannot emphasize this enough. I dream of seeing more young people, become interested in studying disabilities so that they can advocate from a more informed position.
Net hierna, Brandon Beack se Olimpiese drome is verpletter toe 'n gimnastiekongeluk hom verlam gelaat het, maar dit het hom nie gelaat lê nie. Welkom terug. In ons Activated Bulletin sien ons hoe robotika mense in staat stel om weer te loop. Robotika word ontwikkel om verlies aan mobiliteit die hoof te bied. Robotics is the new generation that clinicians and over 270 centres are already using to increase functional gains and attract more patients. It is clear to treat stroke and spinal cord injury patients, and with all they have been adding, you realize it's not just a gait training tool anymore, it is a complete neurorehabilitation program. It is more intuitive and effective for patients. The most significant difference is the new touchscreen and viewer controller with the heads-up display statistics and auditory cues to correct. It's simple to navigate, easy to see, and provides a lot more real-time feedback to help you get the most out of your sessions. The exosuit is a great enabler, but unfortunately, due to the astronomical costs involved in producing them, they remain inaccessible to most people. One person who was the first to use the exosuit was Brandon Beack. We hear more about the research on mobility being done at his foundation, Walking with Brandon. In 2012, a tragic gymnastic accident left Brandon Beack wheelchair-bound as a quadriplegic. He broke his neck at C6 and C7 spinal motion vertebra and was left instantly paralyzed from the shoulders down. After 10 weeks of inpatient rehabilitation, the doctors told Brandon that he would be paralyzed for the rest of his life and would never recover any further.
The Walking with Brandon Foundation started up our Therapy and Beyond Centre here in Rondebosch. This is our first facilities, hopefully of many more to come. Our approach is based on the American model, but it's a holistic approach. It's an approach with a multidisciplinary practice of physiotherapists, biokineticists, speech therapists, occupational therapists, peer support, hydrotherapy. We want to get individuals involved into sports. We offer them guidance back into the working industry through third parties. And it's not just one aspect of a person's life. We need to improve every single aspect of their life. We're improving them as a human rather than just their physical state. Coming from the South African background, our therapy goes as far as inpatient. So you go to hospital, you go to inpatient, they send you home and that's it. So you're left to fend for yourself and you're given no guidance. Often people fall into depression and they lose the hope in their chance at life, and that's it. They just disappear into the system. I felt like that many times during my journey where I just wanted to give up and just felt like I had no help, no guidance. But it's the people around me that helped push me through it. Coming back here, I wanted others to have the same opportunities that I had going to America, because South Africa doesn't have a specialized outpatient rehabilitation program. And we're in such dire need of it. That led us to continuing my therapy here. We also did further fundraisers, got a robotic walking suit at the times, the exobionic walking suit, and partnered up at the time with the Sports Science Institute with a team of biokineticists. And they implemented this program that the Shepherd Centre gave us. So with the knowledge of the Shepherd Centre and the expertise of the biokineticists, I was able to make the therapy that I experienced in America available to the public. And most importantly, the access to rehabilitation should be a right, not a privilege. So that led us to starting up the Walking with Brandon Foundation in 2015 with our subsidized program, which offers this rehabilitation at an affordable price.
And in the wise words of Brandon, you are the only one that can determine your future. Where you are today is not where you'll be tomorrow. Take it day by day and always challenge yourself. Dankie Brandon dat jy jou storie met ons gedeel het en vir die inspirasie om dinge stap vir stap te neem. En om ons program af te eindig, luister ons na die klanke van Celine Leglolo. Bly veilig. Tot volgende week, selfde plek, selfde tyd. Only on SABC2. You belong. Celine Leglolo is partially blind and was raised by a single mom, a hard-working person and a fast learner who doesn't believe that she is disabled.